Did you know that you do not have to cut out carbohydrates to fix your blood sugar? In fact, the fastest way to fix your blood sugars is actually more about adding foods, not eliminating entire food groups like carbs. In this video, we are going to show you how to use each of these 10 foods to fully optimize your biochemistry and reverse insulin resistance on a cellular level so you can bring down your sugars quickly and naturally, and most importantly, sustainably. The underlying mechanism here is what almost no one explains to you in a 12-minute office visit. High blood sugar almost always starts upstream with a hormone called insulin. Insulin is the hormone that unlocks your cells so glucose, the sugar in your blood, can get out of your bloodstream and into the cell where it belongs. When you have spent years riding the blood sugar roller coaster, your cells stop answering the door. The insulin knocks and knocks, and the cell stays shut. That is called insulin resistance. Your pancreas pumps out more and more insulin to compensate, and your blood sugar climbs anyway. The standard answer is a prescription that pushes even more insulin into a system that is already drowning in it. There is no time on a short office visit to teach you how food talks directly to your insulin receptors. Every one of these 10 foods does one of 3 jobs. It slows the sugar coming in. It cools the inflammation that keeps your cells deaf to insulin. Or it wakes the insulin receptor back up, so your own body does the work it was designed to do. You do not have to do all 10 tomorrow. Add them in over the next couple of weeks and stack them. Food number 1, fenugreek seeds. These are small, hard, amber-colored seeds you can find in the spice aisle of almost any grocery store for a couple of dollars. The seed is packed with a soluble fiber called galactomannan. When it hits the water in your stomach, it swells into a thick gel. That gel physically slows how fast your stomach empties carbohydrates into your small intestine. Slower emptying means the sugar trickles into your blood instead of flooding it. No flood, no giant spike, no panic dump of insulin. On top of that, fenugreek carries an amino acid that nudges your pancreas to release insulin more efficiently and helps your muscle cells take up glucose. How to use it? Take 1 teaspoon of the whole seeds and soak them in a glass of water overnight. In the morning, drink the water and eat the softened seeds before breakfast. If the slightly bitter taste is too much, grind them and stir a half teaspoon into yogurt or sprinkle it over your eggs. Start low. This fiber is strong, and your gut needs a few days to adjust. Food number 2, cinnamon. You almost certainly already have it in your cupboard, but the kind you have matters. The common grocery cinnamon is cassia, and it carries a compound called coumarin that is hard on the liver in large daily doses. The one you want is Ceylon cinnamon, sometimes labeled true cinnamon. It is milder, safer to take every day. What makes cinnamon work is a group of polyphenols, natural plant compounds that behave almost like insulin themselves. They help your insulin receptors grip glucose more tightly and slow your stomach from emptying too fast after a meal. Research out of the Human Nutrition Program at the USDA found that under half a teaspoon a day meaningfully lowered fasting glucose in adults with type 2 diabetes. How to use it? Use about 1/4 to 1/2 teaspoon of Ceylon cinnamon a day. Stir it into your oatmeal, your coffee, or a smoothie. The trick is to pair it with a carbohydrate meal, because that is exactly when you want your receptors gripping harder and your stomach slowing down. Food number 3, broccoli sprouts. Not full broccoli, the little 3-day-old sprouts. Broccoli sprouts are loaded with a compound called sulforaphane, and the sprouts contain somewhere between 50 and 100 times more of it than a head of mature broccoli. Sulforaphane does something none of the other foods on this list do quite as directly. It goes to your liver and quiets down the overnight glucose factory. Your liver makes sugar while you sleep, and in insulin resistance, it makes far too much. That is why so many people wake up with a high fasting number they cannot explain. A 2017 study from Lund University in Sweden gave concentrated sulforaphane to people with type 2 diabetes and brought their fasting blood sugar down measurably, with the strongest effect in exactly the people whose sugar was hardest to control. How to use it? You can grow broccoli sprouts on your own counter in a jar for pennies or buy them in the produce section. A small handful, about 1/4 cup, on a salad or sandwich most days is plenty. Do not cook them hard because high heat destroys the active compound. Eat them raw or barely wilted. Food number 4, avocado. Most people think of it as a fat to avoid because of the calories, and that fear is costing them. The fat in an avocado is monounsaturated fat, the same family as olive oil, and it is one of the most blood sugar-friendly things you can put on a plate. That healthy fat and the fiber inside an avocado slow your entire meal down. When you add half an avocado to a plate of rice or toast, you are not removing the carbohydrate. You are putting a brake on how fast it turns into blood sugar. The glucose climbs gently instead of spiking. Monounsaturated fat has also been shown to improve insulin sensitivity, meaning your cells answer that insulin knock a little faster. How to use it? Half an avocado a day is a sensible amount. Put it on your eggs in the morning, mash it onto whole grain toast, or add it to a salad that already has a starch in it. Anywhere you have a carbohydrate, an avocado softens the blow. Food number 5, chia seeds. These tiny gray and black seeds punch far above their size. Chia is one of the richest sources of soluble fiber you can buy. When it meets the water in your stomach, it forms that same thick gel we talked about with fenugreek. That gel wraps around the carbohydrates in your meal and slows their absorption to a crawl. The sugar releases slowly and steadily, so you avoid the spike and the crash that leaves you shaky and hungry an hour later. Chia also carries a plant-based omega-3 fat that helps calm the low-grade inflammation sitting underneath insulin resistance. Cool the inflammation, and the cells start listening to insulin again. How to use it? 1 to 2 tablespoons a day does the job. Stir it into yogurt, drop it in a glass of water with a squeeze of lemon, or blend it into a smoothie. Give it 10 minutes to gel before you drink it, and drink plenty of water alongside because all that fiber needs liquid to move. Food number 6, fatty fish, salmon and mackerel. This one does not work by slowing your meal down. It works on the deeper problem, the reason your cells went deaf to insulin in the first place. Insulin resistance is driven in large part by chronic inflammation. When your body is quietly inflamed year after year, that inflammation physically interferes with the insulin signal at the surface of the cell. Salmon and mackerel are loaded with 2 omega-3 fats, EPA and DHA, and these are among the most powerful natural anti-inflammatory compounds we know of. They lower the inflammatory signals, the cell membrane gets healthier, and the insulin receptor starts working the way it is supposed to. How to use it? Aim for 2 servings a week, about the size of your palm each. Wild salmon, mackerel, sardines, and herring are all excellent. Bake it, grill it, or buy it canned if that is easier on your budget. Canned mackerel and sardines are some of the cheapest, most powerful foods in this entire list. Food number 7, walnuts. Of all the nuts, this is the one to point toward first because of what it does for the lining of your blood vessels and for your insulin at the same time. Walnuts are rich in polyunsaturated fat and the same plant omega-3 found in chia. That fat improves the function of your endothelium, the thin lining inside your blood vessels, which is one of the first things high blood sugar damages. At the same time, the fat, fiber, and protein in walnuts blunt the rise in blood sugar after a meal and have been shown to lower fasting insulin, which is the number underneath your blood sugar that tells you how hard your pancreas is straining. How to use it? A small handful, about a quarter cup or 7 to 10 whole walnuts, as a snack instead of crackers or a cookie. Keep them raw or dry roasted, not the candied or honey-coated kind. Use them to replace a processed snack, not to add on top of one. Food number 8, eggs. Whole eggs, yolk included. For years, people were told the yolk was the enemy, and that bad advice pushed folks towards sugary breakfast cereals that were far worse for their blood sugar. A whole egg is almost pure protein and fat with virtually no carbohydrate, which means on its own, it barely moves your blood sugar at all. But the real magic is what is called the second meal effect. When you start your day with eggs instead of toast or cereal, you steady your blood sugar not just at breakfast, but all the way through to lunch. You walk into your next meal with calmer numbers and a smaller spike. The protein and fat also keep you full, so the mid-morning cravings that send you toward the cookie jar quietly disappear. How to use it? 2 or 3 whole eggs in the morning is a solid target for most people. Scramble them, boil them ahead for the week, or fold in some spinach. Put that avocado from earlier right on top, and you have built a near-perfect blood sugar breakfast. Food number 9, Apple cider vinegar. This is the one with the fastest visible effect on a glucose meter of anything on this list. The active ingredient is acetic acid. It does two things at once. It slows your stomach from emptying, so the carbohydrates in your meal arrive in your bloodstream gradually, and it helps your muscles pull glucose out of your blood and use it for fuel. The research here is strong. Work led by Dr. Carol Johnston at Arizona State University found that a tablespoon of vinegar before a carbohydrate meal lowered the after-meal blood sugar spike by roughly 20 to 30% in people with insulin resistance. That is a drug-sized effect from something that costs a few dollars a bottle. How to use it. Take 1 tablespoon, diluted in a full glass of water, 10 to 15 minutes before a meal that has carbohydrates in it. Always dilute it. Never drink it straight because the acid is hard on tooth enamel and the throat. If you take any medication for blood sugar already, talk to your doctor first because vinegar plus that medication can push your sugar down faster than you expect. Food number 10. Lentils. Lentils are a carbohydrate, and they will lower your blood sugar. Lentils are built from a slow carbohydrate called resistant starch, wrapped in soluble fiber and a healthy dose of plant protein. That combination means the glucose inside the lentil is released into your blood slowly and steadily over hours instead of all at once. They actually carry the second meal effect too, so a bowl of lentil soup at lunch gives you steadier sugar into the evening. Swapping white rice or white potato for lentils a few times a week is one of the most reliable ways to bring down an HbA1c, your 3-month average blood sugar. How to use it. Aim for half a cup to a cup of cooked lentils a few times a week. Use them in a soup, a stew, or a cold salad with olive oil and a splash of the vinegar we just covered. They are filling, cheap, and stretch a meal further than almost anything else. Putting it all together. Every one of these foods is handing your insulin its job back without starving you. The fiber foods slow the glucose down so your pancreas never has to panic. The fish, walnuts, and chia cool the inflammation that was jamming the signal. The cinnamon and vinegar walk right up to the insulin receptor and help it grip again. Do that meal after meal, day after day, and the cell that stopped answering the door slowly starts opening it on the first knock again. That is what reversing insulin resistance means at the cellular level. Important safety warning. If you are on insulin or a sulfonylurea, one of the older blood sugar pills, these foods can lower your sugar fast enough that your medication dose may suddenly be too high, and that can drop you into a low. Add these foods with your doctor watching your numbers, and let them walk your medication dose down as your body improves. Do not stop any prescription on your own. Bring this list to your next appointment instead. Tonight's plan: 5 simple steps. Tomorrow morning, replace your cereal or toast with 2 or 3 whole eggs and half an avocado. That single swap changes your blood sugar for the entire day. Tonight, soak a teaspoon of fenugreek seeds in a glass of water and drink it first thing in the morning. Buy Ceylon cinnamon, not cassia, and start 1/4 teaspoon a day in your coffee or oatmeal. Before your biggest carbohydrate meal tomorrow, take 1 tablespoon of apple cider vinegar in a full glass of water 15 minutes ahead. This week, swap white rice or white potato for lentils at least twice, and put fatty fish on the menu 2 nights. Stack these in over the next 2 weeks. You are not removing the foods you love, you are adding the foods that protect you.